Are you a specialist in infectious diseases?
I am board certified in internal medicine, and internal medicine doctors take care of a wide variety of patients.
Understood. Are you a specialist? I asked a very specific question. Are you a specialist in infectious diseases?
So I am board certified in internal medicine.
Okay, the answer, I guess, is no, which is okay. We're moving on.
Diseases.
Are you a specialist in epidemiology?
I have PhD
I see where you're
training
going. Okay,
in epidemiology.
So you are not a specialist in epidemiology
I have
either.
PhD training in epidemiology and biostatistics and health economics.
Are you a vaccine researcher?
I am not a vaccine researcher.
Okay. I'm curious why you altered key findings in a state-driven study about COVID-19 in your state of Florida. Why did you alter the results of a state-driven survey? If I could, Mr. Chair, enter into the record, April 24th, 2023, Politico article, Florida Surgeon General altered key findings in study on COVID-19 vaccine. Why did you alter the information in that study?
Thank you for your question. That is factually incorrect. I did not alter any findings in any study, and I have a record of multiple NIH grants as a professor at UCLA and a professor at Florida, and those are not easy to get. The study you're talking about is a study that was very unpopular because we had a finding that actually was in sync with what you might expect from myocarditis,
Dr. Ladapo,
which is that we found that there was an increased risk of myocarditis and cardiac death in young people.
In your home state had said on the record to the press that you altered the study, are you saying that is inaccurate?
I'm saying we have a study that showed that young men were at increased risk of cardiac. I've already answered that question, ma'am. I said absolutely not. I have never altered any study. We had a finding of increased cardiac risk that translated into excess deaths in young men in particular. That was a very unpopular finding, but is very consistent with the finding that myocarditis is especially increased in young men. The study was performed by epidemiologists at the Florida Department of Health, not by me. I oversaw the study, and that was the finding, and I personally believe that that finding is accurate.
I have another question. You had said in multiple op-eds, USA Today, March 26, 2020, Wall Street Journal, April 9th, 2020. You spent time taking care of patients with COVID-19 at UCLA's flagship hospital, and yet your colleagues at that institution said that was not true. Did you, in fact, were you the person charged with treating COVID-19 patients?
I have taken care of, at UCLA Hospital, as the attending physician, many patients with COVID-19.
Thank you, Mr. Ladapo.
Mr. Ladapo, the gentle lady from Vermont just questioned your credentials. Isn't it true you have a PhD and an MD from Harvard?
Yes, that's correct, but apparently not enough.
I guess not. Well, I'm going to say that the Pfizer CEO is a large animal veterinarian, okay? And then the person who actually approved the vaccines at the FDA is a hematologist oncologist who ran off the two top vaccine scientists at the FDA, Marion Gruber and Philip Krause, because they said that they would not skip steps to approve the vaccine. And then they also had hesitation about the boosters. He said not everybody's going to need a booster, especially not 8 months after they've received the vaccine. But they were the vaccine experts working at the FDA who were removed of their responsibilities by a guy who didn't replace them with vaccine experts. How do I know this? I was in a transcribed interview for 7 hours with this gentleman from the FDA yesterday. And what we also found out is that the FDA, whose role is to regulate the manufacturers, to make sure that what they say is true, that the claims can be verified, the FDA itself was going out and making 1-minute videos saying things that not only did the vaccine manufacturers not claim, for instance, that their vaccines could stop or slow the spread, but the vaccine manufacturers never asked for approval of to be able to say, and that the vaccine manufacturers would have gone to jail. The FDA would have probably arrested somebody if they had made the claims that the FDA itself was making.